Nobody in the emergency department looked twice at the quiet woman standing beside the nurses, station with a neatly packed bag and a fresh employee badge. To everyone else, she was simply another new hire trying not to get in the way. First day, one nurse asked without looking up from the computer. Elena Vale smiled politely. Yes. Stay close. Fraida's hair can be rough. She nodded, said nothing more, and followed the charge nurse through the busy trauma center. The hospital never seemed to slow down. Phones rang without pause. Stretchers rolled through the hallways. Doctors hurried from room to room while families waited with worried faces. It was the kind of place where experience mattered, and newcomers had to earn respect one shift at a time. Several staff members glanced at Elena's file before handing it back. So she transferred from another hospital, one nurse whispered. Looks young, another replied. Hope she can keep up. Elena heard every word, but her expression never changed. She accepted the simplest assignments without complaint. She checked medication cards, prepared supplies, comforted anxious patients, and quietly learned the layout of the department. Whenever someone asked for help, she was already there before they finished speaking. Even then, very few people noticed. Later that morning, an experienced surgeon hurried past her carrying a patient chart. New nurse, he called without stopping, make sure trauma room 3 is stocked. We may have ambulances coming. I'm on it, Elena answered. Within minutes, every drawer had been checked twice. Equipment was tested. Extra blood tubing was arranged exactly where it would be needed. The charge nurse walked in and looked around. I thought someone already prepared this room. Elena simply smiled. No, she replied. I just wanted everything ready. The charge nurse gave a quick nod before rushing away again. Used afternoon, everything changed. A dispatcher called over the emergency radio. Multiple vehicle collision on Interstate 47. Several critical patients. First ambulance arriving in 7 minutes. The department instantly shifted into controlled chaos. Doctors gathered at the entrance. Nurses pulled on protective equipment. Stretchers lined the hallway. Everyone moved faster. Another update came only seconds later. We're receiving more patients than expected. The charge nurse looked around the room. Every available person, report to trauma. Elena stepped forward without hesitation. The first ambulance arrived with its sirens fading into silence. Paramedics rushed inside while giving rapid reports. Chest injuries. Possible internal bleeding. Multiple fractures. The rooms filled almost immediately. One physician directed people from one patient to another, trying to decide who needed surgery first. Elena quietly watched everything. She noticed something no one else seemed to see. An elderly man lying on a stretcher wasn't speaking much. His injuries appeared less serious than others around him, so he had been placed farther back in line. But Elena watched his breathing. She noticed a slight change in skin color. She saw one trembling hand resting against his side. She walked over to the attending physician. Doctor. He barely looked up. What is it? I think bed 9 needs immediate imaging. The doctor frowned. He isn't our highest priority. I understand, Elena answered calmly. But something doesn't look right. He hesitated. What do you see? His breathing is becoming uneven, and he's trying to hide the pain. I think we're missing something. The doctor studied the patient again. A few seconds later, his expression changed. Get imaging now. Within minutes, scans revealed an internal injury that required urgent treatment. The physician looked back toward Elena. You caught that? She simply nodded. I've seen similar signs before. There wasn't time for more questions. Another ambulance had already arrived. Hours passed in what felt like minutes. The emergency department continued filling with injured patients from the crash. Elena never raised her voice. She never appeared rushed. She quietly anticipated what doctors would need before they asked. A surgical tray appeared exactly when required. A medication was already prepared. A frightened child received calm reassurance while waiting for tests. "You'll be okay," Elena said softly. "Your mom is asking about you already." The little boy finally stopped crying. Nearby, two nurses exchanged confused looks. "How does she stay so calm?" "I have no idea." Even the senior surgeon began noticing unusual details. Whenever decisions became difficult, Elena seemed to predict what would happen next. Not because she took control. Because she paid attention. Later that afternoon, the department finally became quieter. Several lives had been saved. The exhausted staff leaned against counters, catching their breath. The surgeon approached Elena while reviewing patient notes. "You've done emergency work before." She looked at him politely. "A little." "A little," he repeated with a faint smile. "Most new nurses freeze during days like this. I've had good teachers." "Where?" She paused for only a second. "Different places." Before he could ask another question, someone called him away. The answer stayed with him. "Different places." It sounded simple. Yet somehow incomplete. As evening settled outside, rain clouds rolled across the sky. Familia slowly reunited with loved ones. The emergency department returned to its normal rhythm. Elena helped clean the trauma rooms without being asked. No one noticed that she quietly corrected equipment placement left behind by others. No one realized every room she touched became more efficient. The charge nurse watched from across the hallway. "She's unusual," she murmured. "What do you mean?" another nurse asked. "I can't explain it." Outside, the wind suddenly carried a distant sound. At first, only faint vibrations. Then a steady rhythm. Someone near the entrance looked toward the windows. "Do you hear that?" Another staff member stepped outside for a better look. A security officer lifted a radio to his ear. His face changed immediately. "What is it?" the receptionist asked. He didn't answer. Instead, he listened carefully before speaking into the radio. "Repeat that, did you say multiple helicopters?" Inside the ER, nobody understood why the security team suddenly began moving toward the rooftop access doors. The sound grew louder. One helicopter. Then another. Then several more. Doctors stopped walking. Visitors turned toward the windows. Even the exhausted nurses looked outside. Elena slowly raised her eyes. For the first time all day, a shadow of recognition crossed her face. No fear. No surprise. Just quiet understanding. Above the hospital, dark aircraft emerged through the evening clouds, flying in perfect formation toward the emergency department. And before anyone could guess why they were coming, the hospital's emergency phone rang with a message that instantly changed everything. The emergency phone had barely stopped ringing when every conversation inside the hospital fell silent. The charge nurse answered first, listened for only a few seconds, and slowly lowered the receiver. Her eyes moved toward the windows where the growing sound of helicopter blades echoed across the evening sky. "What did they say?" one doctor asked. She swallowed. "They requested immediate rooftop landing clearance." "For who?" They didn't say." Outside, headlights flashed as hospital security vehicles rolled toward the landing area. Staff members gathered near the glass doors, trying to understand what was happening. One helicopter appeared over the hospital. Then another. Within moments, 8 military helicopters settled into formation, circling before landing one after another on the rooftop and nearby emergency landing zone. No one had ever seen anything like it at the hospital. Visitors stepped outside despite the rain. Patients who could walk gathered near windows. Even experienced physicians looked stunned. The chief administrator hurried into the emergency department. Who authorized this? Security simply replied, the clearance came from higher authorities. The administrator frowned. Higher than us? No one answered. The rotor blade slowed, but the tension only grew stronger. A group of uniformed military personnel entered through the secured emergency entrance. Their movements were calm, organized, and professional. They weren't rushing, but every step carried purpose. The hospital director walked forward with a welcoming smile. I'm Director Roland Pierce. How can we assist you? The senior officer nodded politely. Good evening, Director. My staff is prepared for any emergency. We appreciate that. The director waited. The officer asked only one question. Where is Nurse Elena Valle? The hallway became completely still. Several nurses looked at one another. One of them whispered, did he say Elena? The director blinked. The new nurse? Yes. She's only been here one day. We know. The officer's calm expression never changed. We need to speak with her immediately. Across the room, Elena had been organizing fresh supplies. She looked up as everyone turned toward her. For a brief moment, no one moved. The charge nurse quietly approached. Elena. I heard. She placed the supply tray down and walked toward the entrance without appearing nervous. The officer met her halfway. It's been a long time. Elena offered a small smile. It has. I apologize for arriving this way. You didn't have much choice. No. The conversation sounded strangely familiar. Not friendly. Not formal. Simply respectful. The surrounding staff exchanged confused looks. One doctor whispered, how do they know each other? Another shrugged. I have no idea. The officer spoke again. We have a patient arriving in 3 minutes. Condition? Critical. Conscious? On and off. Elena nodded once. I'll prepare trauma room 1. The officer stopped her. He specifically requested you. She looked away for just a second. I understand. Without another word, she turned and walked back toward the trauma bay. The surgeon who had questioned her earlier caught up beside her. Elena. Yes, doctor. Who exactly are these people? They're here for a patient. That's not what I asked. She looked at him kindly. It isn't my story to tell. Before he could respond, another helicopter door opened outside. A specialized medical transport team wheeled in a patient surrounded by military medics and flight nurses. Unlike the earlier accident victims, every movement around this patient followed precise coordination. No shouting. No panic. Only quiet efficiency. As the stretcher entered the trauma room, one medic looked directly at Elena. I'm glad you made it. So am I, she answered. The surgeon noticed the medic's tone. It wasn't relief over finding an available nurse. It sounded like relief over finding the right person. The patient remained unconscious. Medical equipment surrounded the stretcher. The flight physician handed Elena a sealed folder. These are the latest reports. She skimmed only the first page before asking several quick questions. When did blood pressure begin dropping? 32 minutes ago. Any allergic reactions? None. What medications were given during transport? The physician answered each question immediately. The surgeon watched with growing curiosity. No one questioned why Elena was leading the conversation. Not even the military physicians. Instead, they waited for her assessment. After less than a minute, Elena looked toward the surgical team. We'll need imaging first. One doctor hesitated. Shouldn't we move directly to surgery? She remained calm. Not until we confirmed the source of instability. The surgeon studied her face. She wasn't guessing. She sounded certain. Nadie. Let's do it. As technicians prepared the patient, the military officer quietly stepped beside the hospital director. I realize this situation is unusual. You could say that. Our patient requested nurse bail before departure. Requested her personally? Yes. The director glanced toward Elena. I've only known her for 12 hours. The officer smiled faintly. Most people know only a small part of her. Nearby, two younger nurses quietly talked while preparing equipment. Was she military? I've never heard. Maybe she worked overseas. Then why would 8 helicopters come? Neither had an answer. As imaging continued, Elena remained focused. She spoke gently to every staff member. She thanked technicians. She encouraged younger nurses. She double-checked every medication. Nothing about her suggested someone enjoying attention. In fact, she seemed uncomfortable with everyone watching. Later, while waiting for updated scans, the surgeon finally asked the question everyone had been thinking. Elena, where did you learn trauma medicine? She paused. Years of memories flashed across her mind. Temporary field hospitals. Natural disaster zones. Makeshift operating rooms. Lone nights where every decision mattered. She answered softly. I learned wherever people needed help. It wasn't the full truth. But it wasn't a lie either. Before anyone could ask more, the imaging specialist hurried into the room carrying fresh results. Everyone gathered around the monitor. The surgeon's expression immediately became serious. This is worse than we expected. The military physician nodded. We're running out of time. The room fell silent. Then every pair of eyes slowly turned toward Elena. Without raising her voice, she studied the scans for several long seconds. Finally, she pointed to one small detail that almost everyone else had overlooked. If I'm right, she said quietly, the injury isn't where everyone is looking. The room went completely still. Every person in the trauma room leaned closer to the monitor as Elena pointed to a faint detail near the edge of the scan. It was easy to miss unless someone knew exactly what they were looking for. The lead surgeon narrowed his eyes. You think that's the problem? I do, Elena replied quietly. It doesn't match the first report. The first report focused on the most obvious injury. She paused before continuing. This area explains why his condition keeps changing. If we treat only what we can clearly see, we'll lose valuable time. The room stayed silent. No one spoke for several seconds. Finally, the surgeon looked at the radiologist. Run another review. Focus exactly where she indicated. The radiologist nodded and quickly examined the images again. A minute later, he looked up with surprise. She's right. Several staff members exchanged stunned glances. The hidden injury had been there all along. It wasn't large, but it was serious enough to explain the patient's unstable condition. The surgeon let out a slow breath. Good catch. There was no pride on Elena's face. She simply replied, let's help him. Within moments, the operating room was prepared. Doctors, nurses, anesthesiologists, and technicians moved with quiet purpose. The military medical team stepped back, allowing the hospital staff to take over. One officer watched Elena closely. Another younger medic whispered, she's exactly the same. The officer smiled slightly. She always was. As everyone scrubbed in, the surgeon looked toward Elena. I'd like you with us. She nodded. I'm ready. The procedure began with careful coordination. Every instruction was short and clear. Suction. Clamp. Pressure is stable. Thank you. The room remained calm despite the seriousness of the situation. Whenever the surgeon asked for an instrument, Elena already had it in her hand. Whenever another nurse needed assistance, she quietly stepped in before anyone asked. She wasn't trying to lead. She simply understood what the team needed. About halfway through the operation, one monitor showed a sudden change. The anesthesiologist looked up. Pressure is falling. The surgeon adjusted his approach. I'm almost there. Elena studied the monitor for only a second. She leaned closer. Doctor. Yes. The pressure drop started before the last step. A looked at her. What are you thinking? I think we're treating the result, not the cause. A hesitated. She pointed toward another area. Please check there. For a brief moment, the room grew quiet. Then the surgeon carefully examined the area she suggested. His eyes widened. There it is. The source of the problem had been hidden beneath surrounding tissue. A few careful movements later, the patient's condition began improving. The anesthesiologist looked at the monitor again. Pressure is coming back. Another nurse smiled behind her mask. The atmosphere in the room changed instantly. No one celebrated. There was still work to do. But hope had returned. Nearly 2 hours later, the procedure ended successfully. The patient was transferred to recovery in stable condition. The surgical team slowly removed their gloves and masks. The surgeon walked over to Elena. I owe you an apology. She looked surprised. For what? I thought you were simply a talented new nurse. She smiled gently. That's all I am. A shook his head. No. You saw things that experienced surgeons nearly missed. I've been fortunate enough to learn from excellent people. You keep saying that. Because it's true. Before he could continue, the military officer entered the room. May I have a moment? The surgeon nodded and stepped aside. The officer faced Elena. He'll recover. I'm glad. He asked for you before he lost consciousness. I know. He remembered what happened years ago. Elena lowered her eyes. So do I. The nearby staff pretended to stay busy, but everyone was listening. The officer continued. Most people here don't know who you are. They don't need to. I disagree. She smiled softly. This hospital hired a nurse, not a story. The officer laughed quietly. You've never liked attention. No. A looked around the room. Then perhaps they should at least know why experienced military physicians trust your judgment. She didn't answer. The officer respected her silence. Instead, he turned toward the surgeon. Years ago, during several international humanitarian rescue missions, Nurse Elena Valle helped develop emergency trauma procedures for field hospitals. The surgeon looked surprised. I've read about those protocols. The officer nodded. So have thousands of emergency medical workers. Another physician stepped closer. Those techniques are now taught in disaster response training. They are. The room became silent again. The younger nurses stared at Elena. None of them had imagined that the quiet woman stocking supply carts only hours earlier had contributed to methods used far beyond a single hospital. One nurse finally spoke. Why didn't you tell anyone? Elena smiled. Because patients don't need impressive stories. They need good care. No one argued. The answer somehow explained everything. As evening turned into night, word quietly spread throughout the hospital. People weren't gossiping. They were simply trying to understand the woman who had arrived carrying one small bag and asking for nothing more than a chance to work. Yet Elena seemed unchanged. She still helped transport patients. She still checked supplies. She still thanked housekeeping staff for cleaning the operating room. Near midnight, the military officer received another phone call. His expression immediately became serious. He listened without interrupting. Then he looked directly at Elena. "I'm sorry." She recognized that tone. "What happened?" "We've just received another emergency." He lowered his voice. "It's bigger than the first." Several nearby staff members noticed the change. The surgeon stepped closer. "Can we help?" The officer nodded slowly. "I believe you're about to find out why Nurse Elena's experience matters even more than you imagined." Before anyone could ask another question, emergency dispatch announced incoming patients over the hospital speakers. Not one ambulance. Not two. An entire convoy was already on its way. The emergency announcement echoed through every hallway before anyone had a chance to catch their breath. "Attention all emergency personnel. Prepare for multiple incoming trauma patients. Estimated arrival in 6 minutes." The hospital, which had only begun to settle down after the earlier operation, sprang back to life. Doctors hurried toward the trauma bays. Nurses restocked supplies. Respiratory therapists checked equipment one more time. Outside, the flashing lights of emergency vehicles stretched down the road. The military officer walked beside the hospital director. "It was a training exercise," he explained. "A transport vehicle overturned during severe weather. Several people were injured." "How many?" "We're still receiving updates." The director nodded grimly. "We'll make room." Inside the trauma center, Elena calmly surveyed the department. She wasn't rushing from place to place. Instead, she quietly noticed where help would be needed before the first ambulance even arrived. She turned to the charge nurse. "We'll need the recovery room open for overflow." "You think we'll need that much space?" "I do." The charge nurse trusted her without asking another question. Within minutes, extra beds were prepared. The first ambulance pulled in. Ten anote. Patients arrived one after another, each needing immediate attention. The noise level climbed, but panic never took control. Elena moved from team to team, helping each one work more smoothly. She knelt beside a frightened young nurse named Taryn, whose hands trembled as she prepared medication. "I've never seen this many patients," Taryn whispered. Elena gently placed a hand on her shoulder. "Look at me." Taryn did. "You don't have to solve everything. I feel like I'm falling behind." "Then help the person in front of you." Taryn took a slow breath. "One patient at a time." "Exactly." The young nurse nodded. Moments later, she returned to work with renewed confidence. Across the room, one physician paused long enough to notice the change. "You've got a gift," he quietly told Elena. She smiled. "No. Someone once did the same for me." As more patients arrived, Elena quietly reassigned supplies, redirected staff, and kept communication clear. She never barked orders. She asked simple questions. Who needs help? Which room is ready? Who's available? The answers kept everyone moving together. The surgeon who had doubted her on her first day now found himself asking for her opinion before making difficult decisions. "What do you think?" She studied a chart. "I'd stabilize this patient here first. The other can safely wait another few minutes." He nodded immediately. "Let's do it." Hours earlier, he would have questioned every suggestion. Now he trusted her judgment. During a brief pause, two military medics stood quietly near the nurse's station. One watched Elena encourage another exhausted nurse. The younger medic smiled. "She hasn't changed." The senior officer shook his head. "Not even a little." The hospital director overheard them. "You've known her a long time?" The officer nodded. We first met during an international disaster response mission. She never mentioned that. She rarely mentions anything she has done. The director folded his arms. Our staff thought she was simply a quiet transfer. The officer looked around the busy department. That's exactly how she wanted it. It continued after a moment. There were places where hospitals didn't have enough doctors. So what happened? Everyone worked beyond their job titles. Nurses taught. Surgeons listened. Medics trained civilians. Elena became one of the people everyone trusted when resources disappeared. The director looked toward her. Why leave all that behind? Because eventually she wanted a normal hospital again. Nearby, Elena helped an elderly patient sit comfortably while explaining each step of the treatment. The patient smiled weakly. You've been very kind. I'm glad you're here with us, Elena replied. Those simple words eased more fear than any medication could. As midnight passed, the emergency department slowly regained control. Most patients had been stabilized. Several were preparing for surgery. Others rested while families finally arrived. The staff looked exhausted. One nurse leaned against the wall. I don't know how we're still standing. Another laughed softly. I don't know either. The charge nurse walked toward Elena. I owe you an apology. Elena looked surprised. For what? This morning I treated you like someone who needed constant supervision. There was nothing wrong with that. There was. The charge nurse smiled. I should have asked about your experience instead of assuming you had none. Elena gently shook her head. We all start somewhere. You don't seem upset. I've learned that first impressions aren't permanent. The charge nurse laughed quietly. I'll remember that. Across the department, the surgeon gathered several younger nurses. I want everyone to pay attention. They turned toward him. What you saw today wasn't about titles. He glanced at Elena. It was about preparation, humility, and teamwork. The younger staff nodded. None of them would forget this shift. Not because helicopters had landed. Not because military officers had filled the hospital. But because they had watched quiet leadership change everything. As dawn began to brighten the windows, the military officer approached Elena once more. The transport aircraft will leave in an hour. She nodded. I figured. Our command would like you to come with us. Several nearby staff members looked up. The officer continued carefully. There is an opening in our advanced trauma training program. The hospital director listened in silence. It would mean returning to military medicine. Elena looked through the window toward the early morning light. For several long seconds, she said nothing. She remembered crowded field hospitals. Lone nights without sleep. Young medics learning to stay calm under impossible pressure. She also looked around the emergency department. At Tarin, who now moved confidently from patient to patient. At the charge nurse smiling as she encouraged the next shift. At the surgeon who no longer cared where good ideas came from. This hospital had become something important in just one day. The officer waited patiently. There is no pressure, he said. We'll respect whatever you decide. Before Elena could answer, another security officer hurried toward them with urgency on his face. He stopped beside the military officer. Sir, we've just received a secure message. The officer read it once. Then he looked slowly at Elena. His expression changed completely. This decision, he said quietly, may no longer be yours to make. The military officer read the secure message twice before folding the paper and slipping it into his pocket. Everyone nearby watched his face, searching for clues. The hospital director spoke first. What happened? The officer looked toward Elena. It isn't another emergency. A quiet breath of relief moved through the room. Then what is it? The director asked. The officer smiled for the first time that morning. Our command has made a decision. Elena folded her arms. I thought the training position was still under review. It was. And now? It has changed. The officer paused before continuing. They're no longer asking you to return. Several staff members exchanged confused looks. The surgeon stepped closer. I don't understand. The officer looked around the emergency department before answering. They've decided your work is more valuable here. Silence filled the room. Elena blinked. What do you mean? Our leadership believes your greatest contribution is in treating patients one at a time. It looked toward the younger nurses beginning the morning shift. It's teaching people who will spend decades helping others. The charge nurse smiled without realizing it. The officer continued. They want this hospital to become a regional trauma training center. The hospital director stared at him. Here. Yes. And Elena? They want her to lead the clinical training program with our full support. For several seconds, nobody spoke. The offer was unexpected. It wasn't about medals. It wasn't about rank. It was about passing knowledge to the next generation. The director finally broke the silence. If she accepts, this hospital would be honored. The officer nodded respectfully. So would we. Alas turned toward Elena. She looked across the emergency department. Housekeeping staff were cleaning the floors after the long night. The cafeteria worker was delivering breakfast trays. Nurses were checking on sleeping patients. Doctors were reviewing morning reports. Every person had played a part. She smiled softly. I'll accept. Several people quietly applauded. Not loudly. Used enough to show what the moment meant. The military officer extended his hand. Congratulations. She shook it. Thank you. But I have one condition. It raised an eyebrow. Name it. This program won't focus only on military medicine. It won't. No. She glanced toward Taryn, who had just finished comforting an elderly patient. It will teach teamwork, communication, and compassion. The officer smiled. I expected nothing less. Over the next few weeks, the hospital slowly changed. One unused conference room became a trauma education center. Simulation equipment arrived. Experienced physicians volunteered to teach. Military medics occasionally visited to share lessons learned from disaster response and emergency evacuations. Elena never acted like she was in charge. She stood beside everyone else. She listened more than she spoke. Whenever a student asked a question, she answered patiently. If you don't know something, she often said, ask early. Patients are safest when teams learn together. Her words spread through the hospital. Young nurses repeated them during every shift. The surgeon who had once doubted her became one of the program's strongest supporters. During one training session, he stood before a group of new employees. I almost made a mistake on Elena's first day. The room grew quiet. I judged experience by appearances. A smile toward her. I won't make that mistake again. The students listened carefully. That lesson stayed with them long after the lecture ended. Months later, the service member whose life had been saved returned to the hospital. He walked slowly but confidently through the same emergency entrance where he had once arrived unconscious. This time there were no rushing stretchers. No helicopters landing. Just a grateful visitor carrying a small wooden box. He found Elena speaking with a group of nursing students. When she saw him, she smiled. You look much better. I feel much better. He opened the box. Inside was a simple challenge coin from his military unit. I wanted you to have this. She gently shook her head. I appreciate it, but everyone here earned your recovery. Ismail. I knew you'd say that. Instead of handing it only to her, he turned toward the entire emergency department. This belongs to all of you. The room became quiet. Doctors. Nurses. Technicians. Housekeepers. Receptionists. Every person who had helped during that unforgettable night stood together. The hospital director accepted the coin on behalf of the staff and placed it inside a display case near the emergency entrance. A small plaque beneath it read, "Great care is never the work of one person. It is the work of one team." Visitors often stopped to read those words. Many never knew the full story behind them. They didn't know about the helicopters. They didn't know about Elena's years of humanitarian service. They simply saw a hospital where people treated one another with respect. One evening, after another busy shift, Taryn walked beside Elena toward the parking lot. "I've been meaning to ask you something." Elena smiled. "What is it?" "When you first came here, weren't you worried that nobody knew who you were?" Elena looked back at the hospital entrance. The lights inside glowed against the evening sky. She answered quietly, "I hoped they wouldn't." Taryn looked surprised. "Why?" "Because every new beginning deserves the chance to speak for itself." The younger nurse smiled. "I think I understand now." As they reached the parking lot, the familiar sound of helicopter blades echoed faintly in the distance. Several nurses looked up automatically. This time, nobody panicked. Elena smiled toward the sky, and climbed into her car. Tomorrow would bring another shift. Another group of patients. Another opportunity to teach. And another reminder that the greatest heroes were often the ones no one noticed until their kindness quietly changed countless lives.